Today I'm going to talk about the metabolic support with cannabidiol. It's really quite extraordinary the number of benefits that come with cannabidiol, and what's very interesting is the detailed metabolic involvement that cannabidiol has. So what we're going to talk about today is the metabolic conditions of concern. So I'll mention a few of them. Certainly there's so many that it's hard to run down each one, but there can be some specific actions in each of the processes. We're going to look at the burden of disease. How much does metabolic disease, what does it mean in terms of the number of people suffering and the dollar amount? And then contemporary diagnosis and what we're being told about treatment for these conditions. We'll talk about the endocannabinoid system deficiency and give you a perspective from that side. And then I'll talk about CBD metabolic targets, where CBD specifically can be working in a number of different issues, each one being a little bit different. And then we'll go over the dosing for metabolic issues, and I'll give you some references and links to where you can get more information from this presentation as well as a copy of the slides. I'll be answering questions at the end of the presentation, so if you would put those into the chat box, then I can take those questions when the time comes. Now, first off, the metabolic disorder is another one of those spectrum disorders. I've listed off a number of these particular problems and how they all relate, and each one of them has a close interaction with the endocannabinoid system. And so they all have a relationship, but look at how these things all flow together. They're all involved and connected in some way. Certainly, these are the ones that many of us, many people are suffering from, many of our clients. And as you'll see in a moment, the impact on the entire country and the world is really quite phenomenal. Now, all of these particular diseases, just the ones I've got listed here, probably come to about $1 trillion on a yearly basis. We are expending extraordinary amounts of money, time, and effort to handle these particular diseases, and we really haven't found the solutions, something that we can do for these patients that's highly effective and that they'll respond to. Diabetes, of course, I think the number there at 9.3% is way low, and typically in the populations that I review, it's more on the order of 12 or 13%. And obesity, remember, this is the group of people who are over 30%. In terms of overweight, there's really quite a number, probably as many as 67% of the United States is overweight significantly, and that includes the obesity category. If we look at metabolic syndrome specifically, we're looking at 34% of the United States is afflicted with this condition, and we know that this condition leads to many other problems, particularly cardiovascular disease, and there's shown an increase in cancer as well. Now, finally, just on this particular list, I'm going to show you fatty liver, and the reason I brought this up because it's not really recognized how significant this is. The fact that 40% of the United States shows signs of fatty liver, and we're spending over $100 billion per year to look at this particular condition. A lot of people don't realize that this is perhaps one of the culminations of the metabolic disorder, the metabolic problem extending down into our internal organs, particularly the liver, and leading it to be fatty liver being the largest number of transplants, liver transplants that are occurring in the United States are actually in this particular category. So classically, we're told that the pathways of this disease are overeating, typically with a high-fat diet. They leave off the sugar portion. And the other thing is people aren't just not moving. So if you move and you're active, that will take care of the obesity problem and all the other types of problems, metabolic issues that we come against. And so what we have in terms of the conventional treatment is, number one is diet, but I just leave that off. The other is exercise, and those go without saying, but do they really work? Are they really effective? There's a great deal of question. In fact, that's not true. They don't seem to be effective alone in terms of getting control of these conditions and preventing them. For medical therapy, we're looking at hypoglycemics and insulin, trying to drive down the glucose levels and force it into the body. We're using statin drugs to lower lipids. And you're being told if you're not exercising, or if you're still overweight and having difficulty and metabolic issues, then try harder, because you're really not trying hard enough. Not addressing the fact that these things are not being effective. The standard conventional treatment has not been effective, and it's not very good for us. So if you take it from an endocannabinoid system approach, then everything changes. We're looking at the endocannabinoid system as a translator between the neurologic system, the immunologic system, and the hormonal system. And right at the core, it's almost the central fundamental mechanism that's taking place here is you've got the cannabinoid system that's truly regulating some of the micro details that are going on within the cell organelles, within the nucleus, and within the whole body. And yet, it's something that has generally been ignored for almost the last 20 years. When we're talking about endocannabinoid dysfunction, we're really talking about an imbalance of receptors and ligands, so that the connectors to the receptors are either too much or too little, and also the same happens to go for the receptors. There can be too many receptors, there can be too little receptors, and that interaction and that balance seems to be what is at the heart of many of the diseases. In fact, many of the conditions that we'll talk about today that I've already addressed in that previous slide, we're actually talking about those conditions that have been shown to have endocannabinoid dysfunction specifically. And there's clearly documented evidence to show that the imbalance is there. Now, what causes an endocannabinoid imbalance? Well, in general, we can look at it in terms of stress, drugs, and diet. Do we know all of the factors? We know everything that goes on with it? That's not entirely clear. But I can tell you that many of the therapies that we've used and we've learned that seem to be effective in many conditions, in addition to the three things that I mentioned here, meditation and acupuncture, osteopathic manipulation, they all show changes in the endocannabinoid system in a very favorable way. And these things may frequently be perhaps the foundation for getting people better within our system. And they also complement other mechanisms in terms of restoring the endocannabinoid system. If we're looking at evidence, we really are seeing that the endocannabinoid deficiency in metabolic syndrome is related to issues with the brain, the fat cells, the liver, the pancreas, skeletal muscle, and we're seeing changes all over the body, not only in the individual cells, but in the mitochondria. In fact, there's new evidence to show that there are specifically endocannabinoid receptors on the mitochondria that are accepting much of the information to regulate even down to the mitochondrial level. Now, if we're talking about diabetes specifically, what we're seeing is the endocannabinoid function on the beta cell as well as the pancreas shows significant regulation by the endocannabinoid system. So there's extraordinary detail and regulation that's going on, so that it appears that the endocannabinoid system is, to some degree, a translator between these other systems that we have. Now, one of the ways that we can approach this is with cannabidiol, because cannabidiol is effective in a number of ways, and I'll show you that in a moment. But first of all, understand that this is cannabidiol that's coming from hemp. It's safe, it's legal, and it's effective. There are no adverse drug reactions, toxicity, or interactions that are occurring with CBD. None have been found. And it restores the endocannabinoid system. It rebalances. So the fundamental purpose of cannabidiol is to restore homeostasis. So it makes sense that cannabidiol is involved with a lot of the details of how cells work and how our bodies work in general. If we're looking at CBD effects on metabolism, we're seeing an enormous integration and interaction with the entire body system. We're talking about, first off, rebalancing the endocannabinoid system specifically. Now, CBD is a phytocannabinoid, and we're talking about the endocannabinoid system having endocannabinoids as well as receptors. There's good evidence to show that CBD is making adjustments in the number of those receptors as well as the amount of endocannabinoids that are circulating and being released. It's also regulating the neurotransmitters. I mean, that's the whole purpose, at least one of the purposes for the endocannabinoid system, is to tone down the neurotransmitters that are getting too excited, sending out too many signals, giving out too much noise. It's regulating hormones. Now, specifically, we see that hormones such as cortisol, epinephrine, and norepinephrine are being controlled and regulated using the endocannabinoid system. And CBD has specific effects that have been determined on those particular hormone sets. That also goes for the sex hormones, the thyroid, and the hypothalamus, as well as the pituitary gland. CBD seems to be involved in regulating in some of those areas, regulating to normal, nothing exceptional, just getting people back to a normal level. It's promoting lipolysis. Of course, this is really important when we're talking about obesity and we're talking about the inflammatory effects that adipose tissue has, specifically on the visceral type of adiposity and versus the peripheral, where we see that the visceral fat produces quite a bit of inflammatory substances that may be part of the problem that leads obesity to many of the complications, particularly in the cardiovascular area. CBD is shifting the glucose profile. It's moving the way the cell gets energy and how the cell produces energy, and also the number of glucose receptors that are on muscle cells and the amount of insulin that's actually being secreted. There's regulation and modification of that. In addition, it's working on the lipid profile. It's shifting the lipid profile to increase the amount of HDL as well as to decrease the amount of LDL. And the way it does this is really quite fascinating in that it's working on one of the enzymes that moves the cholesterol from inside of the cell to outside of the cell. So it's putting it into circulation, moving it out of areas that where it needs to be removed from. Hence, that's why the HDL is one of those components that the lipid shifts to. If we're looking at right within the mitochondria, some amazing things are happening here, all potentiated with cannabidiol. First off, it's quenching those reactive oxygenation species. Those are the substances that cause damage and destruction and in many cases lead to cell death. It's enhancing the mitochondrial function specifically. We're talking about decreasing the complex 1 and complex 4 reactions that are occurring, and these are the ones who generate many of the oxidative substances, the inflammatory substances, that if they're not in control can cause a cell damage as well as lead to the death of the cell. Now, very interestingly, that cannabidiol is working on the shifting the metabolism of the mitochondria into the pentose phosphate shunt. Now, the pentose phosphate shunt, I know this is going back quite a ways, but this pathway is very, very important for as a restoring a certain amount of energy to the cell and to special functions, but particularly for creating and making DNA, RNA, and many of the enzyme components that are necessary in the cell. In addition, it's using a more energy inefficient pathway, so it's actually burning cell energy. It's created more energy in the cell, and that's going to result in an increased energy use in the individual. As much as 20 or 30% increase in metabolic rates are occurring with the use of certain cannabinoids and the cannabinoid effect that it has on the mitochondria. In addition, we've got cannabidiol actually preventing cell death. As a result of anoxia, ischemia, and injury by chemotherapy agents and radiation, CBD protects cells against the death. Probably that relates to protecting it against the reactive oxygenation species, as well as decreasing the stimulus to self-destruct. If we drill down a little bit further, we're looking inside the cell. You'll see that CBD specifically increases the amount of NADPH, which is involved in the pathway. This is very interesting. It has to do with the reduction of oxidized glutathione. Well, glutathione is a pathway where we detoxify the body and in the cell. And with this effect, you're actually increasing the levels of glutathione, and the result is then you're having more protection inside the cell and protecting it from self-destruction as a result of those inflammatory and toxic events. Now, one of the things that we see is commonly used are the statin drugs. And I want to compare statin drugs to CBD because I think this is very elucidative. That statin drugs works as a total pathway inhibitor, blocking the mevalonate pathway and many of the functions and the constructive functions of that pathway. It also lowers cholesterol. There's a cholesterol reduction, and that is well accounted for. However, one of the things that tends to be overlooked is that there's a 14% incidence of increased diabetes using statins. Furthermore, there's at least a 20% incidence, perhaps even 30 or greater, of neuromuscular adverse events that are occurring related to it. And furthermore, there's at least $50 billion in this industry worldwide. It's a huge, huge market is being pushed on many, many people. Now contrast that with CBD that offers all of the same benefits, if not more. Number one, it promotes the lipid efflux out of the cell so that it's moved away from those areas of concentration, and particularly in the endothelial lining where atherosclerosis is occurring. It prevents oxidative LDL. So LDL in itself is a natural substance that we have, but when it gets oxidized, that induces an inflammatory reaction that probably is the source for much of the atherosclerotic processes, especially in the coronary arteries. It suppresses the numbers of macrophages. Once again, these are involved with the inflammatory reaction within the cell leading to atherosclerosis. It inhibits the cytokine release from those inflammatory cells. So even those fewer macrophages that are around, the cytokines and the inflammatory things like tumor necrosis factor are not being released to create an inflammatory situation. And one other thing is very, very important is that it's preventing platelet type of action. I'm not saying that it's going to be a blood thinner. I'm telling you that the hypercoagulation that occurs with these inflammatory situations is prevented and is reduced and normalized with the use of cannabidiol in cardiac situations and inflamed situations. So you're getting all these benefits in comparison, and CBD doesn't have any side effects, and it doesn't have any toxicity. It's hardly a fair comparison. So how do you use it? How do you use cannabidiol in those metabolic situations to help restore people to their potential, their full health potential? Well, one way, and I like the standard approach, is to start off with 15 milligrams twice a day. I think that's a good basic dose that gets people started. And then as a provider, I'd like to see you adjust the dose to match the needs of the individual. And that could be more or less. You want to find the right amount that gets the most benefit from using it. So that means it could be 30 milligrams twice a day. That's not very important, at least in terms of the lack of side effects or toxicity. You're free to do what you need to adjust the dose. Adjust the dose early and boldly. And what I mean is doubling the dose, using significant amounts and adjusting it early within the first few days, in most cases, will make a significant difference for the patient. You should see effects immediately within a few hours, if not minutes, of initial doses. The duration of action is typically 6 to 12 hours. So you get a good twice a day. Sometimes you'll need to use it 3 times a day. And I have focused on these metabolic problems as responding very well to 30 milligrams a day. So easy to achieve with a standard dose. So let's go over some of the things that we talked about. I know there's a lot of material here, and I didn't go into a huge amount of detail. But I mentioned the huge burden of metabolic disease in this country. It's just phenomenal, approaching at least $1 trillion. I concentrated on the endocannabinoid deficient, which is a common entity in our population, people we're seeing, and it seems to be an epidemic issue for so many conditions, but particularly for the metabolic areas. Cannabidiol addresses the pathways of metabolic disorders very specifically, going into tremendous detail down to the mitochondrial and the DNA level, signaling changes and shifts in whether it's receptors or it's hormones that are being secreted and are adjusting the body. It's supported in numerous preclinical studies and certainly in lots of case studies that have been documented in the medical literature. Unfortunately, there are not many human randomized controlled trials. Remember, too, there are no adverse effects, toxicity, or drug interactions, and the dosing is really easy with fast results that we're seeing with cannabidiol. So I've gone over the main points that I really wanted to get across. I've listed off some key references on this slide. Talk about, I've got a number of documents as well as the slides that are located in the reference and slides link. And you're welcome to go in that. If you have difficulty getting in, let me know, and I'll be glad to make some adjustments on that. Well, terrific. It's been great talking with you about metabolic disease and cannabidiol. I'm really pleased to have you join me, and I hope that you'll invite your friends and your colleagues so that we can have more discussions about this incredible substance.